Shall I share my screen here?
I'm only seeing yourself at the moment. Yeah, something sharing. Yes, yeah, I can share it. Yeah, I can see it. Yeah.
Okay.
Perfect.
All right. Thank you. Thank you, everyone, for coming, and thank you for hosting me. And sorry if I missed the opportunity to come and see you in person. I have so many things happening today. Actually, it's quite busy time of the year, as everyone know. So my presentation, as you can see here, the title about BIM properties for psychological-based code compliance checking for mental health care facilities. Actually, it is part of a PhD study. This my student Selba, he is a PhD student from Thailand, and you can see from in my presentation that I will refer to Thailand so many times because actually the case actually is about healthcare facilities in Thailand, mental healthcare facilities in Thailand, and actually the idea of the study is about looking at mental health care facilities that require special design considerations, especially when locals and patient populations and equipment become all valid in terms of the context of the usage of these facilities. Designing these facilities requires innovative techniques to improve patient and staff psychological health. So the services, the facility improvements, everything actually can have some kind of different type of usage where patients needs informed design, and the operation of the healthcare facilities actually will require this type of special requirements. So the idea of the study is to look at these type of differences and what special needs are required for these facilities and how BIM systems can accommodate this type of requirements, especially for the psychological factors. So the papers actually give us a kind of idea, part of results part of the study actually is quite still, I mean, we are at the end almost of this study, and we have published another papers based on the other results. So I will just give you what this paper is telling about. So the idea is to, in general, is to develop a framework for building compliance or code compliance checking based on BIM systems. And see how the current, of course, there are so many, you can say, automated building code compliance checking systems available. While we studied this and we try to see what else is needed for these systems to actually accommodate all the features that is required for this type of facilities. As you can say, traditionally, I mean, where this study came from, actually, traditionally healthcare facilities or healthcare hospitals are designed based on past experience, generally with similar projects and architectural standards. However, this type of way, or this way of designing these hospitals lacks the evidence that such experience will be transferable, especially when locals, patient populations, and local culture and context affect the business of the building, or when we say business of the building for hospitals, the performance of the building in relation to the healthcare provided to patients. So local context would have a significant impact on design and the socio-economic status and the way that the medical people actually assess their treatments to provide it to patients and the efficiency and effectiveness of that type of treatment processes. So this type of area which try to you can say link or integrate the core business function of the building with the building performance itself, and how they are interacted, and how building design impact on the core business of the building, and in this case is the healthcare or mental health care facilities. So there is always a need to promote some kind of innovative techniques to improve patient and the staff psychological health, whether through surface improvement, organizational improvement, or facility improvement, with emphasis on patient-centered practice, of course, for this case, where the patient's needs inform the design and the operation of the healthcare services and facilities. On the other hand, for BIM, BIM offers, of course, the potential for a new generation of tools that can automate checking of buildings or code checking of buildings, and we already have some kind of tools that can help us in that. However, one of the limitations for the conventional BIM-based code checking systems for healthcare facilities is that they operate with the conventional design code compliance logic. So, I mean, they focus on the normal type of attributes or physical attributes of building to ensure it comply with the coding or the building code. So there is a kind of lacking of capability to inform the designer of the patient's psychological requirements. So what can be, what else should be considered for such type of facilities, and how BIM can actually accommodate these parameters. The method or the methodology of the study actually goes through this principle called evidence-based design, and it is a principle which tries to get kind of practical or empirical data about the impact of different building variables on performance. So it gets some kind of studies that we try to actually here to cover number of studies who try to make this link. And in the context of this study, you can see here that in Thailand, many studies actually show linkage between architectural design and mental health in healthcare facilities. And some of the studies also emphasize that they should be considered when designing such type of buildings, because the population there are practicing their religion, and also there is some kind of local culture which impact on this type of buildings for mental health patients. So we surveyed the number of published work based on this methodology, evidence-based design, and we get some kind of results that try to make this linkage between the architectural properties of the building and the psychological factor effect on patients. And the purpose in general is to develop a framework that make this correlation between the psychological factor and the design parameters for this type of buildings. And based on this framework, a tool will be developed, already developed by students to make this type of code checking, automated code checking for building of healthcare buildings, considering these psychological factors. So among the results that we get here, as you can see in this table, we have a number of selected psychological factors. Of course, the list is quite longer than that, but these are the most important 7 psychological factors in literature, which have been identified by previous researchers that they are the most measurable kind of factors that the psychologists actually assess patients based on. And you can find on the other column the parameters which are attached to these factors. How did we identify these parameters? As I say, it mainly from literature, from other simulation tools and other type of research done within or somehow related to what we are doing here. And as you can see here, what we try to do is that the automated code checking or code compliance checking using BIM models have been used for such type of or data. I mean, the architecture parameters that we see here are already available in BIM tools that can be used to be measured through BIM applications. However, the limitations identified for this available checker, they don't allow complete customization of checkable rules. So there are some rules that should be developed to link these two factors and parameters. These factors or these psychological factors, some of them can be measured, objectively or through kind of measurable tools, and others are kind of subjectively can measure through maybe some kind of surveys among patients, and they can define kind of levels of improvements, satisfaction, for example, or these type of things. And so there are some of them are subjective type of factors, others are measurable in terms of number or something like that. The point here is to take this architecture parameters, and try to identify what are the BIM can say variables that should be identified on any BIM model to be used for simulating the performance of buildings, and how this can impact on the factors. So the correlation actually between these two columns is the main issue here. So the other thing which we defined as well is to look at the parameters and the BIM properties, and so we define this list of BIM properties, and in our approach is that these parameters and properties required to be conducted in BIM simulation, while there are different measuring matrices could be used. Only the matrices or this parameter or the properties that can be simulated within BIM platforms are defined. The BIM properties requirements here for the design parameters are identified to be within level of detail 300, as suggested by other as well designers, or from our data from our discussion with experts. We need at least the design level of details of BIM models to be up to 300. So to be able to define all of these, to enable us to actually simulate the effect of these parameters on the psychological factor defined. So the point here is to help developing this tool that will measure these parameters and set some kind of rules. It is rules to define the limits, or to define what limits should be each of these BIM parameters, BIM properties, to allow or to be linked to the achievement or the progress of the psychological factor, to link it with the patient's progress in terms of treatment. So the study actually concluded, or this paper especially, the conclusion is to try to establish this relationship between the psychological factor and the parameters, and in a way to develop the tool for the building code checking. And as you can see, while all the data collected are PIE focused, but of course the approach itself can be considered for other cons or other local healthcare facilities in any other countries. Just the approach itself is quite innovative in terms of looking at this core business of buildings with the normal building performance. And actually, this approach is now expanded to be applied on a digital twin scale, in terms of having different digital twins for different systems, for example, for patients or for building occupant, and the building of the digital twin for the building itself, and how these two digital twins interact with each other and impact on each other. So one digital twin will be focused on the business or the core business of the building and the operations and the processes of conducting the business itself. And the other, of course, is the typical digital twin on the building performance itself and the physical properties of that building. So this is our paper, and thank you for listening.
Thank you, Ibrahim. Thank you.
Thanks.
Obviously, because Ibrahim has to go and he's live, is there any questions that you'd like to put to Ibrahim while we have him here at the moment? It's a quiet room, Ibrahim. You're getting off the hook easy. That's great. Thank you so much for making the time to dial in today. And obviously, there's a paper with the presentation. I presume, is there for the proceedings?
Yeah.
Excellent. So obviously, if you want some more information or kind of more detailed, Ibrahim and his PhD students' numbers are there, or email addresses are there, so you can reach out to them directly. Thanks again, Ibrahim.
All right, thank you.
Thank you.
Bye.
Bye-bye.
Thanks, bye.